Hello friends, welcome to Shri Netralaya. In this video, I am going to show you a surgical modification for prevention of intraoperative expulsive hemorrhage and vitreous loss in open sky procedures. This case is a cataract with corneal opacity. So plan is very simple to perform a penetrating keratoplasty and open sky cataract extraction with IOL implantation. So while performing open sky technique procedures or open globe procedures, the risk of expulsive hemorrhage and vitreous loss is very high. Two sutures with a crisscross pattern are pre-placed and we can call them the safety sutures. It helps in situations of increased IOP, which can lead to expulsive hemorrhage and vitreous loss. As you are well aware, expulsive hemorrhage is a potential dreaded complication of any open sky or open globe surgery. The beauty of the procedure is it is simple, easy, no extra instrumentation needed except for a 6-0 Vicryl, which is almost in all OTs are readily available. Once these two sutures are pulled, you can get a very good center of cornea, which will help in a good central trephination of corneal tissue. It will be a bit tricky to manage these sutures while performing your surgery and trephination, but once you get used to this, it is not a difficult job at all. We can use 8-tooth marker before so that we can have perfect placement of these sutures and a good centration. Once this is done, I will take these sutures out of the surgical field. Using central guidance mark, I am placing 8-tooth marker, which will help me later in the surgery for placement of penetrating keratoplasty sutures. As already mentioned, we are planning keratoplasty and cataract. So I want my globe to be firm before proceeding for trephination and anterior capsule to be stained. A stained anterior capsule is easier to handle in open sky procedures. I would like to emphasize on importance of a firm formed globe before proceeding for trephination, because this way you will get a sharp edges of your trephination and you will not get any slopy edges of trephination margins, and this helps you to have a very good graft host approximation in a post-operative period, and it controls amount of astigmatism also in a post-operative period. Once the anterior chamber is entered, the rest of the area which is partially trephined can be removed with right and left-handed scissors. The angle of the scissors is very important, again to have sharp edges and not slopy edges. We can clearly see here a stained anterior capsule. I am putting some amount of visco to increase my visibility and trying to do best possible rhexis. But see, what I have got here is Argentinian flag sign. It is not uncommon to get Argentinian flag sign in such scenarios. You can clearly note the nucleus is coming out on its own due to. So from this point onwards in this surgery, you are at very high risk of vitreous loss, expulsive hemorrhage, and your reflexes need to be fast. My 7.5mm refined tissue is already kept in place. So in case I have a situation of increased IOP and vitreous loss, I will immediately pull my safety sutures to close the globe. Here I am using rigid 3-piece intraocular lens which will also support the posterior capsule. I prefer rigid IOLs in such scenarios. And note, these steps I have finished off quickly because I don't want my globe to be open for long duration. As soon as this is done, I will take my pre-placed safety sutures and pull them in position so that globe is almost closed. As soon as I pull these sutures, note the globe is closed as my sutures are in place and I am ready to take cardinal sutures. I am taking first suture here. You must have noticed I have not washed cortex. I don't want it to do it in an open sky way. I will do it later in the surgery. The simple reason behind postponing this cortex wash is to decrease the chances for PC rent and vitreous loss. This small yet powerful surgical modification can save your day and someone's vision for lifetime by preventing dreaded complications like expulsive hemorrhage and intraoperative vitreous loss. You can note globe is well formed once 4 cardinal sutures are in place. You can remove these safety sutures at this point of surgery, but I usually keep it till my 8 sutures are over. Then you can simply cut these sutures and remove them. Once the globe is well formed, I am going with my Simcoe cannula for cortex wash. This is followed by remaining application of intermittent 8 sutures to complete 16 sutures in a typical keratoplasty case. I usually keep this small air bubble in the anterior chamber. This air bubble acts as an intraoperative keratometer to guide me for tightening of my sutures. So the advantages of these limbal safety sutures are it prevents dreaded complication like intraoperative expulsive hemorrhage. It immediately closes eyeball and decreases the chances for vitreous loss during surgery. It prevents graft from rotational shift and controls post-op astigmatism. It also prevents endothelial cell loss by preventing graft dislodgement during maneuvers. Hope this will help. Do subscribe to our YouTube channel Dr. Pankaj Lande, Shri Netralaya for more such exciting videos. Good day.